And welcome to CARE, How People of Faith Can Respond to Our Broken Healthcare System, with our current YDS student, Christy Charnel, and YDS alumni G. Scott Morris, Joshua Narcisse, and J. Lawrence Turner. This panel is hosted by the Center for Continuing Education, and I'm Kelly Morrissey. I'm the Managing Director of the Center. We really want to thank you all for being with us today. There's going to be a time for questions at the end, so just to let you know that. If you have any questions, you can hold them till then. And Christy is going to moderate our conversation today, so I'm just going to briefly introduce everyone and then turn it right over to her so they can get started. So Christy is a Master of Sacred Theology candidate at YDS, where she recently received her M.Div, a graduate of the University of Pennsylvania School for Nursing. Her research interests lie at the intersections of religion, medicine, and critical Black studies. More specifically, she's interested in the religious ecologies orbiting the construction of the human through the medical and theological enterprise in the United States. Currently, Christy is a fellow in the Yale Program for Medicine, Spirituality, and Religion, an Institute of Sacred Music student, and teaching fellow for Yale College. Dr. G. Scott Morris is the founder and chief executive officer of Church Health in Memphis, which opened in 1987 to provide quality, affordable health care for working, uninsured, or underserved people and their families. Dr. Morris has an undergraduate degree from the University of Virginia, a Master of Divinity degree from YDS, and an M.D. from Emory University. He's a board-certified family practice physician and an ordained United Methodist minister. Dr. Morris was inducted into the Tennessee Healthcare Hall of Fame in 2020, as an honorary Doctor of Letter from the University of Memphis in 2015, received the Memphis Theological Seminary's President's Humanitarian Award and the Kindness Revolution Spirit of Kindness Award in 2010. The Reverend Dr. J. Lawrence Turner is the senior pastor of Mississippi Boulevard Christian Church in Memphis, Tennessee, and serves on the board of directors for Church Health. Prior to coming to Mississippi Boulevard, he served at Community Baptist Church in New Haven. A native of Nashville, Tennessee, Pastor Turner is a 2003 magna cum laude graduate of Fisk University with a Bachelor of Arts degree in Religion and Philosophy. He was a 2001 United Negro College Fund Andrew Mellon Undergraduate Fellow and a 2002 Fellow of the Fund for Theological Education. He received his Master of Divinity degree from YDS and was awarded the prestigious H.H. Tweedy Prize for Exceptional Promise for Pastoral Leadership. Pastor Turner received his Doctorate of Ministry degree in Transformative Leadership at the Colgate-Rochester-Crozer Divinity School in Rochester, New York. And last but certainly not least, the Reverend Joshua Narcisse is a native of Queens, New York, now residing in Memphis, Tennessee. He's a graduate of Howard University and Yale Divinity School. Joshua is a minister of Word and Sacrament in the Presbyterian Church. He's served previously as the inaugural Faith and Health resident at the Mississippi Boulevard Christian Church and Church Health, and is currently the director of spiritual care at Church Health. There he offers pastoral and spiritual support to staff and patients, coordinates interreligious programming. Joshua is the co-host of The Mystic, a monthly discussion forum on topics of spirituality, faith, and meaning, hosted at Crosstown Concourse, and also serves as an adjunct instructor at Bard High School, Early College, Manhattan. Everyone, welcome. Thank you for being here.
Thank you so much. Thank you to the Yale Divinity School Continuing Education, Kelsey Morrissey, for this opportunity to moderate, learn, and be in discussion with this wonderful panel. I'm so glad to be here, and it's such an honor to be able to speak with you all about your work and advocacy at Church Health. This afternoon, we have the opportunity to speak with Dr. Morris, Reverend Dr. J. Lawrence Turner, and Reverend Joshua Narcisse, who, as we have heard from their extensive bios, think, practice at the intersection of healthcare and religion. The medical-industrial complex, which encapsulates healthcare and medicine in the United States, is a site of contention, anti-Black warfare, where many marginalized individuals, a category comprised in the U.S. of Black, Brown, Latinos, Indigenous, queer, trans, poor, jobless, houseless, incarcerated, and the disabled, find their bodies subsumed within the political machinations of subjugation, dispossession, and commodification. In light of this reality, other modes of being, living, and ethics must be imagined and created to attend to these violences. Church health is an example of this otherwise possibility that is, quote, already here and already enacted, a la Ashawn Crawley in Black Pentecostal Breath, for us to model and pursue. They provide us with an ethic, a mode of attending to life for those on the margins of society in the midst of an ongoing quotidian death. This afternoon, our panelists are asking us to think alongside the directive of care, probing how people of faith can respond to our broken healthcare system. This inquiry will hopefully allow us to build upon their work in our respective communities and religious institutions. So, to commence, I want to think about church health through its origin and lineage, in which its work is indebted to and derives its coherence. What is church health's origin story? Why Memphis? And what genealogical terrain does church health model itself after?
All right, that starts with me, I guess. All right, so, we have a video.
Yeah.
Oh, yeah, let's show the video.
For more than 30 years, Church Health has played an essential role in the Memphis community, providing high-quality care to those who would otherwise be unable to afford it. We understand that hope, health, and healing happen when we care for the whole person. That's why we bring faith, medicine, movement, work, behavior, nutrition, and friends and family all together in one place under one roof. That roof is Crosstown Concourse. Less than 2 miles from the heart of downtown Memphis, this former Sears Roebuck distribution center was revitalized and reopened in 2017. 1 million square feet of vertical urban village combines arts and education with shops, restaurants, and vibrant public spaces. As the anchor tenant of Crosstown Concourse, Church Health occupies 150,000 square feet and surrounds all 4 sides of the west atrium on the first 3 floors. Our medical clinic extends over 2 floors with 52 exam rooms consisting of urgent care, primary care, and subspecialty care. Keeping in mind the whole person, we embed counselors, dietitians, and health coaches right in the clinic. Our staff and extensive network of volunteer providers, hospitals, and labs support their needs to ensure quality of care. Church Health knows health starts at the youngest ages. Through our Family Medical Residency Program, in partnership with Baptist Memorial Medical Education, we ensure well-being for patients and their families while training the next generation of doctors. When our patients have a debilitating stroke or injury, our goal is to get them back to work as soon as possible. That's why Church Health offers extensive physical rehabilitation services to our patients. Community partnerships also make sure patients get the services they need to address balance, reduce the risk of falls, and support families who suddenly find themselves in the role of caregiver. In response to the growing need of adult dentistry, we have built one of the largest freestanding dental clinics in America, entirely focused on the underserved and uninsured. We have a team of dentists, hygienists, and many wonderful volunteer providers who see hundreds of patients each week and are truly changing people's lives. In partnership with the Southern College of Optometry, Church Health Eye Care Clinic is located in Focal Point at Crosstown Concourse and is one of the only community eye clinics in the area. Through state-of-the-art eye care, we can catch preventable diseases and preserve patients' vision and employment. Many people see their doctor for physical pain, but the root of their problem is often a broken heart. That's why our mental health professionals and network of volunteers are available to patients during their clinical visits and conveniently through telehealth appointments. While patients visit any number of our clinics, childcare is offered at no cost. At The Well, we provide research-based programming focused on prevention and wellness for children and their families. Your mother always said, "You are what you eat." Through community cooking classes in our nutrition hub, we teach patients and community members to learn and love to cook healthy food. For so many in Memphis, quality health care is out of reach. It's mothers, fathers, brothers, sisters, children. It's our neighbors. That's why Church Health exists. Today and every day, Church Health makes it possible for more Memphians to access the quality care we all need to live our lives with dignity, vitality, and joy. To learn more about Church Health, visit churchhealth.org.
All right, so the question was our origin story. So we didn't actually start with what you just saw. I grew up in Atlanta. I was always interested in the church, but the thought of preaching 52 sermons a year sent shivers down my spine, still does. I don't know how anybody could do that. But as a teenager, I read the Bible and came to realize that a third of the Bible has to do with healing the sick. It is literally on every page. But I would look around to see what churches did, and there just wasn't much to it. We prayed for people on Sunday morning. The pastor was expected to visit people in the hospital. A few people visited the shut-ins, and that defined our healing ministry. All over this country, we had built large hospitals that have church names on them. They do good work, but they have almost nothing to do with worshiping congregations. It seemed to me that there ought to be more to it than that. So I set out in my own life to figure out what would that look like. So I go to college, and then I come to YDS. So in applying to seminaries, I wrote to multiple seminaries asking, what would you think about connecting faith and health? Most either said, nutty idea, or good idea, we got nothing. YDS sent me a letter that I am 99% sure was written by Margaret Farley with a 10-page statement on how this would work if I came to YDS. So I come to YDS, and I spent most of my time looking at what the church has historically done. And come to realize there's a reason these hospitals have church names on them. We just forgot. You know, if you want to talk afterwards about historically, I can talk all day long about it because I learned it here at YDS. But then still trying to figure out what is this going to look like in my own life. So one day, I am in David Duncombe's office. Some of y'all might actually remember who David was. So he, full-time faculty here at Divinity School, but was the chaplain of the medical school. And I'm down at the medical school in his office, and I look on his desk, and there's a little pamphlet that says, How to Start a Church-Based Health Clinic, written by Granger Westberg. And I go, that's it. That is what I want to do. So based on that, after I finish YDS, I go to medical school. I do a residency to be a family doctor. I'm ready to start my own church-based health clinic. I want to stay in the South. I didn't want to go back to Atlanta. And then, not making this up, I read somewhere that Memphis is the poorest major city in America. And based on that, I go to Memphis. At this point, I was 33 years old. I was too young, too dumb to realize that what I wanted to do had no chance to succeed. So I went totally selling out of an empty cart. And probably the most important thing to talk about here is that Church Health is a true faith-based organization. You know, we are not a federally funded anything. We are focused, and our mission is actually not to solve the great social problems in America. We actually don't know how to do that. We're not even trying to do that. What we are about is trying to engage the church and the broader faith community to ask the question, what is our role in caring for our bodies as well as our spirits and the care for the poor who are sick? You know, in this country, there are currently well over 30 million people who are uninsured. They're almost all working, plus the immigrants. You know, when Bernie Sanders advocated Medicare for all, he didn't actually mean Medicare for all. You know, if you are undocumented, you fall off the roof and you break your leg, in that plan, the plan would be to go back to Mexico. So our mission is to, in today's world, figure out what that would be. And our focus is on people working in low-wage jobs. So we take care of the people who work to make our lives comfortable. They cook our food, take care of our children, wash our dishes, cut our grass, will one day dig your grave. They don't complain, yet when they get sick, their options are very few. So we currently care for just over 80,000 people. We are the largest faith-based, privately funded health center in America. A lot of disclaimers there. But anyway, that's enough to get started. So.
Wow, that's quite amazing origin story to think through, especially how you got to there and how YDS was instrumental in being able to allow you to be able to think through medicine and religion. And so I'm actually curious to know, like, when you were going through like your residency program and the like, how did you continue to merge your passion for religion and and medicine at the same time, because I know in medical field it can be a site of contention at times, and I know you also have an upcoming book, Care, How People of Faith Can Respond to Our
This
Broken
book right here
Healthcare.
that everybody can get, it's going to be released in 2 weeks.
Right. So how does your book also attest to that stories and what narratives arrive?
So to really understand what we do, you have to understand our view of health. So being healthy is actually not about the absence of disease. The World Health Organization will agree with that. You know, who cares if you live 2 years longer, if it means 2 years longer in a nursing home? Life for life's sake can't possibly be the point. Breathing in, breathing out, none of us are signing up for that. So what we think being healthy is about is ultimately 3 things. Having more joy in your life, having more love in your life, and being driven closer to God. So if those things aren't happening, then what is the point? And we would argue that's true no matter who you are, what you're doing. It should be focused on more joy, more love, and being driven closer to God. Now, if that's what it takes to be healthy, it actually doesn't have a lot to do with the doctor. So this led us to create something we call the Model for Healthy Living, which is a riff on what's known as the social determinants of health. So we will argue there are 7 things in life that are equally important to life that must be in balance if you're going to be healthy. So one of them is medical care, but it's only one. You know, this country is currently spending $1 trillion a year on the doctor, the hospital, and drugs. But it only has 10% to do with your health outcomes. 10%, that's it. You could argue we're not spending the money very wisely, and I think you'd be right. And the second is nutrition. Your mother told you are what you eat. She was right. Movement, our bodies were made to move. Emotions, family and friends. Work, we define work as those things that bring meaning to your life. And lastly, your faith life. We can actually argue strongly that your faith life is as important as anything the doctor would do. So those 7 things drive all of the programming you saw in the video. And it is what motivates us, and it's ultimately how I got to be connected to these 2 guys.
Yes, absolutely, and that's a great way to go into learning more about Reverend Turner and Reverend Narcisse, how you all got to this work at Church Health, specifically in relation to Black people in the Black church. How did you come to find yourself wanting to learn more about medicine and religion? And what unique role does Mississippi Boulevard Christian Church offer for those in need and sick? And I'm also very much interested about your scholarship and practices and traditions that kind of inform where you are.
So while we were both here at YDS, we were discerning all of this to happen.
Used to meet in the
I was still
refectory
in my
every
mother's
day.
womb when he was here at
Oh,
YDS.
man, did you really have to say it like that?
No, I've been in Memphis almost 10 years coming this March. And one of the first people to welcome me to the city was Scott Morris. But that was based off of our connection of being YDS alums. We just began to have a dialogue about the city of Memphis and to know Memphis. Memphis is overwhelmingly African American, over 62% African American. And when you look at the people who come through the doors of Church Health, they're African American, they're Black and brown people. That I can't even place a percentage on it, but overwhelmingly, that's who it is. And so, as the leader of an African American congregation in the city, there's no way I felt that our congregation could sit this out. As we live in a state that has not expanded Medicaid, so there are 300,000 people in Tennessee that don't have adequate health care coverage. And if they're working, Church Health is the place where they find themselves. And so we've sought, one, not just to support the work and try to embody that model for healthy living in the life of our congregation, but part of my role, even outside of being on the board, is, well, how do you speak up on behalf of those who don't have a voice but who fall into this gap in healthcare coverage? And so through other, particularly advocacy work with African American clergy organizations I've built across the city and the state of Tennessee, that which they might not be able to do as an institution, I'm able to do, because I think we've oftentimes relegated prophetic ministry to prophetic preaching. It is not just about the message, we want to see the ministry. And sometimes the ministry is to work with your state legislators to craft legislation that you then go to the state capitol and you lobby the left and the right around what is right. And it is to make the committee hearing room the pulpit and to speak truth to power. And that is the work that we're still engaged with through partnerships such as the Tennessee Justice Center to advocate for those who have been left out, but yet who are the salt of the earth and are the backbones of our community. And so that's how we join into this work with Church Health, not just making sure it succeeds as an organization in its ministry to those who've been left out and looked over, but also to address the larger dynamics in the system that creates so many people who've been left out.
Absolutely. I think the point that you mentioned about the role of the church honing in on the prophetic ministry instead of solely the preaching is very poignant. And I know there's a video that Joshua Narcisse showed me that kind of attests to these different things that Mississippi Boulevard does, and I would like to speak.
American male success.
Career started back in 1999, so they opened the clinic for about 6 months, but quickly realized it was not a health issue in the sense of just being a health issue. It was an education issue. It was academics. Children were entering kindergarten not prepared.
No, we want to be a good partner. So I've come with a check for $10,000
Oh my gosh, I got my hair today. Wow.
Perea, and we hope that it will help close that gap as you continue the work that moves forward.
Oh, this is so awesome. This means so much. I wish I could hug you right now.
We gotta stop.
And I wanted to highlight that one because Perea Elementary School was started by Church Health, right? Mm-hmm. And the kind of impact of the Boulevard's outreach ministry in every kind of phase, whether it be financially contributing, whether it be volunteer hours and sweat equity, makes an impact in pushing the needle toward a healthier Memphis. I like the phrase that you used, Pastor Turner, a consequential congregation in Memphis, Tennessee, that's able to make a true impact on the lives of the folks who are most marginalized, from these littlest ones in preschool all the way up to our elders.
Yeah, absolutely. And I would like to use this moment to kind of learn more about your story and how you got to Church Health as well.
Ooh. Grace. Lots of grace. Let me put my slide up. Oh, wait, here we go. Lots of Boulevard. There we go. I got here through being a resident in faith and health. I was discerning what to do next in YDS. Like a lot of students, I was enamored by folks like Willie Jennings and Ebony Marshall Turman and thought, quite obviously, I'm going into the academy. Right. And then got terrified when I was trying to put together a personal statement and really did also realize that first call was to pastoral ministry. Mm-hmm. And was discerning what to do next. Didn't think I was ready to be anybody's senior pastor, and was walking past the career services area, and the coordinator there popped up and said, "Hey, have you ever considered going to Memphis?" And I'm from Queens, New York. Enough said. But I learned about what the ministry of Church Health and Mississippi Boulevard were. And what struck me particularly about Church Health was they were caring for the folks who taught me in Sunday school, right? They were caring for the kinds of folks who used to walk me back and forth to church, who loved on me, who made it possible for me to be in a place like Yale. And it felt like an opportunity to give back to the kinds of folks who made me Joshua. And so I learned about what was going on in Memphis. It helped that they flew me out there and interviewed me and wowed me with Crosstown. You really got to go to Crosstown Concourse and just stand in it. But once I got there and was able to have that dual ministry of being at Church Health and tending to every facet of a person's health, right? Which was never a way health was talked about to me growing up. And then being able to be at the Boulevard and just see the kind of impact you can have from a local congregation when the narrative has become that the local congregation is dead, was an incredible way to begin my ministerial journey, right? And I'm so grateful for the opportunity to have said, I was a resident in this brand new program that they were selling me, and I'm so grateful that I said yes, because it's given me a perspective on how to take the next step when it comes to ministry that will always be at the intersection of faith and health.
If I could just piggyback, not just on your story, but on the quality of the care at Church Health.
Yeah.
Oftentimes, nonprofit clinics are just doing the bare minimum. I can say without any fear of contradiction, the care, the service, the facility is probably better than my own physician's office. It speaks to the dignity that is involved in the care that is provided, that what is offered is not any less than what the wealthiest individual could qualify for. And I think that speaks volumes of the character of the ministry that goes forth from Church Health.
No, absolutely. That's something I definitely noticed when I was watching video and looking online about Church Health, the fact that you are able to do dental care, which isn't usually something attended to in non-profit clinics, optometry, giving people means to learn how to take care of themselves in regards to food, and all these different aspects is very attest to the importance of arriving to a wholeness that is addict to what Church Health is doing in Memphis. So I'm curious to know, what's some of the challenges that kind of have persisted over time for Church Health in being able to provide this type of health, especially since you mentioned this is not federally funded. So how do we go about funding, especially for congregations here that might be thinking about what steps they could do to be able to do this type of work?
Yeah, so we have a budget of $25 million that we have to raise year after year after year, so real money. The value of what we do is a little over $200 million a year, so we have 1,000 doctors who volunteer with us. We have 20 on our staff. This is what we do, but I'm not a cardiologist or an orthopedic surgeon, so if we need that, then that gets donated. An example though of the complexity of what we do, so we run an urgent care clinic. That's for the most part what I do these days. So I see a guy who's 50 years old. He works in concrete. Pray you never have to work in concrete. He's complaining of pain in his knee. I x-ray his knee. Every last person in this room would look at that x-ray and go, that ain't right. So he needs his knee replaced. So I'm talking to him about getting his knee replaced. So we have an orthopedic surgeon who will donate his or her time to do the surgery, but I also need anesthesia, radiology, pathology. They're all donating. As long as they're donating, then the hospital will not generate a bill. I'm still missing something though, right? That piece of metal that we're gonna put in his knee, that's gonna come from Smith & Nephew. And this is the complexity of caring for people in this situation. So I tell him, we can replace your knee and the pain is going to go away. At which point he then asks me, will I have to miss work? Anybody here got their knee replaced? You're going to miss work. And he goes, well, I don't know. For now, the duct tape works just fine. Look, nobody in America should have to duct tape their knee in order to go to work. So we have to make a new plan. So I work on a way for him to see our physical therapist while he's working that summer. And then in the winter, we replace his knee back to physical therapy so he can get back to work in concrete that next spring. So raising the money is one thing, but keeping 1,000 doctors happy, trust me, that's not easy. But then it's all about engaging congregations. Yeah. Church health is fundamentally about the church. It is so hard for people to get their head around that, especially in the church. One of the things I learned about here at YDS is I totally 100% blame Descartes for this problem. Descartes convinced us that you can take a human being and separate us into a body and a spirit. We put the body on one side and say it's the purview of science and medicine. We put the spirit on the other and say it's okay for the church to mess around with your spirit, but heaven forbid we cross this line and actually care about our bodies. So that is a fundamentally, I believe, non-Christian, non-Jewish, non-Muslim idea. You know, it is crystal clear from the gospel, even from Genesis. You know, when God breathes the breath of life into the dust of the earth, and Adam and Eve are now made human, it is only when they are dust and breath that they are fully human. We have fully bought into Plato and Descartes in this world. The best example I could give of you about that in the church is that the least healthy meal you could eat every week is at a church. You know, our churches have blessed the sin of gluttony for the sake of fellowship. You know, there's something fundamentally flawed about this. Anyway, so this is, you're asking me about the challenges about this. Raising the money is one piece of this, but truthfully, the hardest thing I've been able to do is to find pastors like Jason who actually get it. Yeah. You know, who realize that a healing ministry is vital to who we are as Christians. You know, the call to discipleship, I've said this, is to preach, teach, and heal. You do not get to take a pass on the healing part. Do you really want to, at the end of time, look God in the face and have God say to you, did you think I was kidding about that part? Right. You know, so finding a way to engage clergy around wanting to be involved in this work has actually been my hardest thing for the last 35 years.
Wow. That's very telling about our ministerial congregations for this time period. And in light of that, I'm curious to know, because of the ongoing COVID-19 pandemic, did you find that like faith communities were coming to you to learn more about how they can integrate this medical approach in their congregations, especially knowing that a lot of communities experience disproportionately higher rates of death and the like? So I'm curious to know, how did that go about? How did Church Health and Mississippi Boulevard mobilize towards providing help for people during this ongoing pandemic?
I think the biggest thing that happened at the beginning of the COVID-19 pandemic in Memphis, being one of the buckles of the Bible Belt, was that Dr. Morris called imams, rabbis, Christian pastors together, and just laid it on us. This is what's happening, and really put upon us the burden of moral leadership is needed now. And so when we came together around a strategy of how we use our pulpits to trumpet the need to look after our community and to demonstrate what's evident in all the Abrahamic faith traditions, which is not just the love of God, but the love of neighbor, and to live that out as we ministered during the pandemic. And so it was working not just to get the word out about how to protect yourself and your family, your loved ones. At one point before there was vaccination available, it was, once we know there are people in our congregations who are testing positive and are having to quarantine, how do we get to them supplies that they need, and food and things of that nature? So to see churches work together, to not just do the massive food distributions, but to make sure those persons who were COVID positive were able to get the things they needed to make it through those, 7 to 14 days where they were cut off and isolated. And so as the pandemic went on, it was coordinating with Church Health, as they were coordinating with our county health department, with doing testing, also doing vaccination. One of the things that Dr. Mars introduced that we still do to this day is once we discovered that we could do PCR testing with pods, I was able to begin to think about reopening my offices and church by testing our staff, testing those who would sing, testing our musicians. So things like that would not have happened if we didn't have a player in our community like Church Health. And so it becomes important that even though it's named Church Health, it has also been a hub for those who might attend a mosque or the temple. It's been that vital overall in our community, particularly in the COVID-19 pandemic.
Absolutely.
And what I might add to that is, I'm coming out of a civic context in which there is, because of the sheer size of New York City, a robust safety net operation publicly, right, within city government. You can't say the same thing about the city of Memphis. The safety net are places like Church Health and our faith communities, right? So if our faith communities and Church Health aren't showing up, folks are falling through the crack. And we saw that when it came to access to testing at the top of the pandemic, as Pastor Turner was talking about. And so in partnership with our faith communities, we were able to sit down with the health department and say, so you've got access to testing in these rather well-to-do and affluent neighborhoods, but the most positive cases are on the other side of town where there's no access to testing. How can we leverage faith communities to create mobile testing sites where folks are actually going to trust that if I come to church where I worship, I can actually trust they're going to treat me right in this testing experience and make sure that we're getting full access to testing so that we know what the situation is. And then once vaccines showed up, being able to just replicate that and say, let's go to our churches, let's go to places of trust and relative safety and administer the vaccine, do the kind of vaccine education that's necessary. And it wouldn't be possible unless the safety net that exists between Church Health and Mississippi Boulevard and our mosques and our temples were willing to come together, put aside differences, and focus on how can we preserve life.
Thank you so much. I think this importance of safety net is a recurring theme throughout the presentation. And I want to use this moment now to open it up to the audience to be able to field some questions about how anything that might have come to mind in regards to the presentation.
Gigi?
Scott, I'm going to bring you a mic. So as you all were talking, I was thinking to myself, I recently moved back to this town and had to pull together a whole bunch of medical professionals and paraprofessionals to address my normal situation of, having turned 70 recently. Okay, well, I can't get a damn appointment, here, there, yonder for months in advance. Finally, I have a PCP. I guess I used to call them GPs, but, and, it took me months to get into her. My question, it's a comment and a question. The question is, I would now, having listened to you folks, want to bring like a 5-page essay that I write saying, okay, now this is what I need. And I'm willing to work for it. And I would like you to know me in this way and address these things for me as a whole person. Could you speculate on how my general practitioner might react to that?
Can I answer?
Wow.
Yeah, go ahead. I would say they're going to react to, can I find you another doctor?
Well, that's my worry. And I don't know how much you know about how the reputation of Yale Health is right now, but it's in the gutter. Everybody I talk to, at least my age, and living in the condo complex I live in, they're like, as soon as you say the name Yale and put the word health next to it, they go like this. Everybody. It's so, it's gotten too big. And I grew up here, so this is very different than what I grew up with. And I just moved back after 40 years away. So I really want to think about this in constructive ways. Yes, for myself, but you guys inspire me to want to think about it in a more collective way too, especially watching, my beloved city and county start to, really have its problems with the delivery of healthcare, which just looks ridiculous around here.
Well, I want to try to offer a bit of a response. I think you start, as we're trying to start, at the beginning, right? How are you training physicians? One of the things that we do at Church Health is our family medicine residency. There's a bit about it in the video. And once a month, I sit down with doctors who have never thought about spiritual dimensions of anything and say, so have you talked to your patient about the quality of their faith life? Where are they finding peace and joy, right? If they come in and they tell you, which truly happened, my mother died yesterday, and not only do I have to worry about burying her, but the roof needs replacing, and I don't know how I'm going to afford both of those. And then you find out her blood pressure is spiking. She's never had an issue with blood pressure before. Maybe you need to call someone in to have a conversation before taking that blood pressure again, right? And we're continuing to try to form physicians on the front end that are able to be doctors that see the whole person when that patient walks into the exam room. And we're getting ready to do that with Meharry Medical College, with a partnership that's hoping, praying, we need your prayers to get Meharry to Memphis so that there are Black doctors who are treating patients that look like them and are treating the entire patient that sits in front of them in the exam room.
Can I just speak to that last issue? And I'm out recruiting. So there are 168 medical schools in America. There are 4 historically Black medical schools in America. So Morehouse in Atlanta, Howard in Washington, Meharry in Nashville, and a little small school out in California. There is only one medical school in America that is affiliated with the church. Meharry is actually a United Methodist Church institution. So I don't have enough time right now to explain it. I can tell you more about it. But we are in the process of creating a Meharry and Memphis campus with the plan for me ultimately to move Meharry totally to Memphis.
He's hoping.
But, you know, as we've already talked about, Memphis is a Black city. Memphis becomes a city that trains Black doctors. But most importantly, we are wanting to raise up kids who grow up in the inner city, who actually have the capacity and the desire to be a doctor. Now, right now, that is not going to happen because there are 1,000 points of leakage. But what would happen if the church could actually get behind these kids through mentoring so that they actually could go down this path, not to be nurses, not to just graduate from college, but to be physicians? You know, the only way this is going to happen is if we can find a way, but what a great opportunity for the church. If you're interested in this, talk to me.
Yeah.
Oh, questions.
We're not going to make it.
I'm not advocating for getting rid of Medicare, Medicaid, or health insurance, but the more we've pushed our care to the state, to a commodity as in personal health care or personal insurance, we're putting the responsibility, we're absolving ourselves as a community of our care. Whereas you mentioned putting the care at the church level, the church knows what the needs of the community that they're serving. How do we get it back where we do get the care away from the state or from the corporations to the people that need it or the people that can address the needs from a public health standpoint of their people?
So start by preaching it from the pulpit. Or for example, in 2,500 pages of the Affordable Care Act, the words adult dentistry do not appear. It is not in there. Dentistry is an economic issue. You can't go from a minimum wage job to a better job if your teeth are all messed up. It is not going to happen. So I see this guy who has a dental problem. He goes to the dentist. He can't afford the dentist. So he took measures into his own hands and he super glued his teeth together. What he didn't understand is that super glue will eat away all the enamel in your mouth. So by the time I saw him, his mouth was a total disaster. You know, this is America. When did it get to be that I'm working, I'm taking care of my family? You have dental pain, one of the worst pains you could have, and your only option is to super glue your mouth. We consider that to be immoral. And by we, I mean the church. But has anyone in this room ever preached a sermon on dental care? Again, Church Health's mission is to engage the church. You know, we got to figure out what does it mean to take seriously a healing ministry.
The state, we put the state responsible for it, not the church. I think from a political standpoint, we also need to push the politicians to push it to the level of the church and the people. It's a political, I mean, that's where the money is, it's in the politics.
It's fine.
Yeah, go ahead.
Anyway.
All right.
So after the exhaustion that COVID-19 has produced, specifically in the healthcare system, it is extremely difficult for doctors to actually be present and care because they're just so overworked. So I'm just interested to know, because you mentioned earlier how you're pushing doctors to ensure that they're taking care of their patients and acknowledging their whole bodies. How, in a culture where you have 1,000 volunteers, are you keeping the spirit of the doctors up to ensure that they can still provide a high level of care as a volunteer? Because in the healthcare system, what often keeps a lot of the doctors in the midst of their exhaustion is the money that they're making.
I think the short answer is that's part of my job, right? We push doctors to make sure they're caring for the whole person because my job is to make sure someone's caring for the doctors. Now, on the staff level, that means I am the pastor to folks who work at Church Health. And when folks walk into the office and they are here to take care of folks who are in desperate need, but they're holding the broken pieces of their lives that might have just fallen apart as they were walking out of the door that morning, it's my job to sit there and listen, to be compassionate, and to help them figure out how they're going to hold those broken pieces until they come back together. Which, side note, you need to take systematics with Dr. Willie Jennings, because in that class, that's how I learned how to do that. I learned how to use the theology I was learning in this classroom and bring it into that pastoral and spiritual care area. But when it comes to our network of volunteers, it's reminding them over and over of the patients that they're caring for. Because what we know about volunteer, what we know about service is that you get way more from the serving than you are ever giving out. And so if you're able to understand that I'm in private practice or I'm working for a hospital system and I'm being forced to see patient after patient after patient, you need to know that this carve-out that you're seeing with our patients is making a measurable difference. And so telling the stories of the patients that are being seen by volunteers, continuing to shower them with appreciation, and letting them know that we are resources for them where they have nowhere else to turn, for someone to listen to what's going on, continues to draw folks into this work. But to your point, it is not easy because we're in a culture of deep exhaustion in the healthcare field.
Look, I know we're running out of time, but this book, not to sell a book, but this book, the fact of the matter is, Church Health is not the only entity out there doing this work. You know, there are clinics similar to ours, many of whom that we have spawned all over this country, and the book is actually about the work that is being done all over the country. So anywhere from Cactus, Texas, to Sacramento, California, to New York City even, this is telling the story, and it's about trying to encourage us all to go out and do what the gospel's called us to do.
Well, thank you. We are out of time. I know there are a couple more questions, so maybe our panelists would be willing to stick around for a few more minutes, but we do have another event coming up in this room, so I'm afraid we do have to wrap it up. But thank you all so much. Thank you for the work that you're doing.